The last time you brushed your teeth and saw blood, you probably thought the same thing most people think. My gums are a little sensitive. I need to floss more. You rinsed, put the toothbrush down, and forgot about it. It feels like a minor dental inconvenience, not urgent. And because it feels minor, you may have done this hundreds of times without thinking twice. But that blood is not staying in your mouth. Micro tears in the gum tissue create an entry point for bacteria into the bloodstream. And once those bacteria reach circulation, they trigger an inflammatory response in the arterial walls, the same walls whose flexibility determines your blood pressure reading. Moderate to severe gum disease is associated with significantly higher rates of hypertension. The blood in the sink was a warning, just not the kind anyone told you to pay attention to. Nearly half of adults over 30 have periodontitis. That means this is not rare. It is so common that it starts to feel normal. Dentists mention inflamed gums at checkups. Patients nod, and life continues. But the mouth and the cardiovascular system are not separate. They share circulation. Every bleeding gum and every inflamed pocket around a tooth can become an entry point into that shared system. And this connection is not new. The link between oral health and cardiovascular health has been in cardiology literature for over 2 decades. It simply never became part of the standard conversation between a dentist and a patient. Healthy gum tissue forms a tight seal around the base of each tooth. That seal has one important job. It keeps the bacterial environment of the mouth separate from the bloodstream. But when the gums become inflamed, that seal starts breaking down. Micro tears develop in the gum tissue. The barrier fails. Certain bacteria associated with gum disease can enter the small blood vessels in the gums and move from there into general circulation. The immune system sees those bacteria in the bloodstream as foreign invaders, so it launches an inflammatory response. That response releases inflammatory signals that make the arterial walls stiffer, narrower, and less relaxed. And when arteries become stiffer and narrower, the heart needs more pressure to push blood through them. Think of the arteries like a garden hose. When the hose is flexible and wide, water flows through easily at normal pressure. But when the hose stiffens and narrows, you have to turn up the tap to get the same flow at the other end. And this is why most people miss it. Gum inflammation is largely painless in its early and moderate stages. The gums may bleed. They may look swollen, but the pain signal most people wait for often does not show up until the disease is advanced. There is one more layer: nitric oxide. Nitric oxide helps blood vessels relax and widen naturally. But the inflammation triggered by periodontal bacteria can suppress nitric oxide production. Less nitric oxide means less natural arterial relaxation. Now the arteries are becoming stiffer, while the system that should relax them is getting weaker. That is how bleeding gums can become part of a blood pressure problem. And it also explains why the usual blood pressure advice may help, but still not fully solve it. You cut sodium, and your blood pressure improves slightly. You add magnesium and potassium, and the numbers move a little more. You manage stress, and the numbers are better than they were, but they are not where you want them. That pattern matters. Blood pressure that improves with diet and lifestyle, but plateaus before normalizing, is one pattern often seen when an inflammatory driver is still active. All your anti-inflammatory efforts are working against a chronic inflammatory source that continues operating regardless of diet or stress management. Gum inflammation is bacterial and immune. It does not respond just because you eat better or manage stress better. You have been treating the arterial stiffness while leaving the bacteria causing the stiffness untouched. You were not doing the wrong things. You were doing incomplete things. The missing piece was never on the nutrition label or the stress management plan. It was in the mouth the whole time. Gum disease progresses silently with age, and the longer it goes unaddressed, the deeper the bacterial pockets become. Arterial flexibility naturally decreases with age, so the same bacterial load has a larger impact on a 45-year-old artery than on a 30-year-old artery. A 45-year-old with 10 years of untreated mild gum disease has not had one bad month. They have had a decade of low-grade bacterial entry. Nitric oxide production also declines with age. The system that naturally helps arteries relax is weakening at the exact same time the bacterial inflammation is building. Three things running in the same direction. That is why the numbers keep climbing despite doing everything else right. The first shift is to treat the source with a professional deep cleaning, scaling, and root planing. This clinical procedure removes bacterial deposits below the gum line that brushing cannot reach and closes the entry point. Studies show measurable reductions in blood pressure within weeks of such periodontal treatment. The second shift is to change the daily habit that matters most. Brushing alone does not address the bacterial environment between teeth and below the gum line. Interdental cleaning with floss or interdental brushes disrupts the bacterial film that causes gum inflammation, and it takes 2 minutes a day. Then use an antibacterial rinse before brushing or oil pulling if that is your preference to lower the same. The third shift is to ask the question nobody is asking. Doctors monitor blood pressure and dentists monitor gum health, but rarely talk to each other. Ask your doctor if your periodontal health has been a contributing factor and whether a referral to a periodontist makes sense. Ask your dentist how significant your gum inflammation is given your blood pressure history and what a periodontal assessment would show. These are not aggressive questions. They are the questions that connect two parts of the same system that have been managed in separate rooms for too long. She is not managing two separate health problems. She is managing one that has been treated as two, and that changes everything. So think back to the last time you brushed your teeth and saw blood in the sink. You rinsed, moved on, and treated it like a small dental issue. But that small daily moment was connected to something much larger, the pressure inside your arteries. The entry point to your arterial health is not only in a pharmacy or a cardiologist's office. It is also in your bathroom, twice a day. And there is one more layer. The bacteria and inflammation from bleeding gums do not only affect arterial walls, they can also affect insulin sensitivity. So if your blood sugar has been climbing alongside your blood pressure, there may be one shared inflammatory driver underneath both.